iBOCA is an app we designed to detect cognitive impairment, specifically early onset mild cognitive dysfunction. Dementia is becoming an increasingly important public health issue, and the World Health Organization has even labeled it as a public health priority. Currently, around 50 million people are suffering from some form of dementia, with an added 10 million cases annually. In 2015, the estimated societal cost of dementia was around $818 billion, and researchers estimate that this number will only increase as the number of dementia cases is expected to triple by 2050. While dementia cannot be directly treated, early detection is helpful because it allows us to manage people's symptoms and improve their quality of life. That's where we envision our app playing a role. iBOCA can assist with early detection. Our app acts as the next generation of the Montreal Cognitive Assessment, or MoCA, which is a pen and paper test that screens for mild cognitive assessment. The app consists of 10 tests which assess cognitive domains including attention and concentration, executive functions, memory, language, visuoconstructional skills, conceptual thinking, calculations, and orientation. Each test takes between 1 to 3 minutes, and you can choose to administer all of the tests consecutively or only choose to administer specific tests depending on what you want to screen for.
We feel that iBOCA is unique because of its versatility. Typically, a trained individual is needed for common screening instruments and tests. With iBOCA, you can choose to administer the test by a proctor in a clinical setting, or it can be self-administered without any help. We've designed the app so it has detailed instructions and built-in videos that guide the user through the testing process. Ideally, iBOCA will be especially useful for people in medically underserved communities and in rural areas around the world. Self-administered testing is convenient and can be done by anyone regardless of how comfortable they are with technology. It's also a cost-effective option for people with a family history of dementia or anyone who's worried about their cognitive function and might want to regularly test themselves. There are also many benefits to virtualizing the tests. We can collect fine granular data and take more accurate measurements. Our app can keep track of how long it takes users to complete the task, and it also stores data regarding how they interact with the task itself. Collecting more detailed data helps practitioners treat their patients, and hopefully over time, this data will provide significant insight into the nature of dementia and other forms of cognitive impairment. Another reason that iBOCA is convenient is because it has auto-grading abilities, so users can see and easily interpret their results right after their test is completed. They can choose to share their results with a healthcare provider or loved one, or even store them for their own personal records. iBOCA stores data whether or not the user answers correctly, which provides more insight into the user's cognition. Currently, we are working on establishing a gold standard for iBOCA and compiling normative data. COVID-19 has presented unique challenges in terms of patient testing, so we are administering our testing remotely at participants' homes using methods in compliance with the guidelines preventing the spread of the COVID-19 virus. We created a zero-contact remote testing protocol, which involves driving to the patient's homes, dropping off an iPad and any other testing materials, conducting testing from a remote location, and then going back to retrieve the materials. This way, we administer testing safely without risking participants' health. Remote testing makes things more challenging, but also allows us to see how feasible the self-administered aspect of the app really is. This process has shown us that self-administered testing is a realistic goal.
In the future, we hope to offer 2 to 5 minute comprehensive and autonomous tests. iBOCA will act as a form of preventative care against dementia as we work to understand as much about the disease as possible through the tests. We envision our app becoming a staple in the healthcare industry and reaching all parts of the globe, tracking cognitive ability and hopefully becoming integrated with healthcare networks as part of routine clinical procedure. With iBOCA, we can change the future for millions of people.